Tonight, a wide-ranging interview with Congressman John Faso. The New York Republican will tell us why he voted for the controversial House health care bill. We'll also get into a whole lot more. Then we are live from the State House in Trenton, New Jersey with the latest on the government shutdown there. And President Trump spending this holiday weekend attacking the media. We'll tell you why this time it is different and perhaps even more troublesome. Good evening and welcome to RFL. I'm Andrew Whitman in for Richard French. Even though it's a long holiday weekend for most people, Senate Republicans are continuing their work on their health care bill. They've sent the outlines of two versions to the nonpartisan Congressional Budget Office so the CBO can score that bill. They're hoping that the score is more favorable than the first bill that was found to dramatically increase the number of uninsured people, according to the CBO. Republican senators are at home and they're starting to face some of their constituents. Bill Cassidy of Louisiana just got an earful from people who are upset and concerned about potentially losing their coverage. So now Republicans find themselves at a crossroads. President Trump floated the idea of a backup plan if the GOP can't pass a bill. He suggested repealing Obamacare first and then working on a replacement package some point down the road. But many lawmakers prefer trying to repeal and replace at the same time. Even with all the dissension, White House advisor Kellyanne Conway says she's confident a deal will get done.
Very hopeful, very confident that the president can have the bill in his desk this summer. So this is to help the millions of Americans who were left out, who were lied to about keeping their doctor, keeping their plan. And in terms of the procedure, it could either be repealed and replaced at the same time, or you could do what happened in the 2015 Senate bill, where every Republican senator who was there except for one voted, and they voted to immediately do away with the penalties and taxes under Obamacare. They dealt with Medicaid as well.
The House bill needed a lot of arm twisting to get enough votes to pass, and the Senate bill likely to need the same. Joining me now, Republican Congressman John Faso of New York's 19th District. He was a key contributor to and voted yes on the House bill. Congressman, you ran for Congress on the platform of repealing and replacing Obamacare, but I don't think either one of us expected that you'd be so inexorably linked to the bill. The amendment bearing your name is in both the House and Senate versions, and it's entirely plausible that your re-election campaign will hinge on health care. Given that, recent polling has support for the health care plan at 12%, 17%, and the high water mark Fox News at 27%. Having any second thoughts at this point?
No, in fact, I think it's really important that we get a replacement done. It's vitally important that we have a plan that the American people can understand and agree with. But it's also important that we speak frankly about the problems of the Affordable Care Act. And I've said all along we should keep what works in the ACA but fix what doesn't.
I want to talk about the health care bills in aggregate right now. And we look at the number of coverage cuts in insurance coverage that are being estimated by the CBO, 22 to 23 million across the country, about 66,000 people estimated in the 19th district. How do you respond to numbers so alarmingly high?
Because I don't think those numbers are correct. I mean, Andrew, given the fact, look at what CBO said when the ACA was enacted. They said by this time there'd be 23 or 24 million people in the ACA exchanges. There are fewer than 10 million in the exchanges. So CBO has been wrong on a number of factors, particularly when they take into account subjective things like how many people will choose to buy insurance. For instance, in that 22 million number that they say will lose insurance, they're counting over 5 million people today who are currently paying the fine instead of buying insurance. Now, how can they possibly say those people are losing insurance when right now they're paying a fine to not buy it? I mean, it defies logic and common sense. I think that their numbers are grossly misstated, and that's why I don't think they're relevant.
But isn't that a tad disingenuous, Congressman? Because the CBO, when it scored Obamacare, didn't realize that the Supreme Court was going to allow states to opt out of Medicaid expansion, and that changed the dynamic of those numbers. I mean, that seems like it's cherry-picking the CBO a tad.
No, it's not, Andrew, because what I said, CBO said there would be 23 million people in the ACA exchanges. That's not Medicaid. There are fewer than 10 million in those exchanges. Now let's look at the Medicaid expansion. What the ACA did, they made a promise that was not affordable. They said that all the states would get a 90% reimbursement for all the new people that were signed up on Medicaid. And I can tell you, sitting on the Budget Committee, I can tell you the growth in Medicaid spending is simply not affordable from the federal standpoint. We're already at $19 trillion in debt. CBO itself says we're going to go to $29 trillion in 10 years. And they're very good at calculating the federal government's financial ledgers. They're not so good at calculating how many people will buy insurance or not buy insurance, but they're good about the ledgers. And we're $19 trillion in debt. One of these drivers of that debt going to $29 trillion in 10 years is this unaffordable Medicaid expansion. So the 90% promise that President Obama and the ACA drafters made to the states is simply not affordable. Would not be responsible for us to tell people we can continue printing money and putting these costs on our children and grandchildren. It is not simply financially acceptable to me.
One of the better tools that I've seen from a bipartisan standpoint for analyzing healthcare is the Kaiser Family Foundation. They have a tool up on their website that lets you slot people's ages and their income levels and see what the impact of the healthcare bills are likely to be on their premiums and their deductibles. And under almost no scenario is there one where people in New York pay less, whether it's, regardless of age, location, or their income level. So why would this be?
Actually, there are. The Kaiser, one of the things that we're trying to accomplish with this legislation is to equalize the tax treatment for people who don't have employer-provided health insurance. 165 million Americans have employer-provided health insurance, and that benefit is not taxable to them. But if you don't have employer-provided health insurance, you have to pay for it entirely yourself. There's no tax subsidy. So I agree with the concern that at certain age and income levels, lower income levels, some people are not going to get enough in the tax credit to buy the insurance. But if you're making over $40,000, $50,000, you have a family, husband and wife, 2 or 3 kids, you're going to do much better under the House passed plan. What I think we need to do is to adjust these tax credits so that people who are lower income get a little more benefit. And all of this can be adjusted, Andrew, but the key here is that the government does not have a bottomless pit of money. And a lot of the ACA proponents just seem to think the money grows on trees. It doesn't. We've got to have more affordable, cost-effective health plans for people. Let people choose not just the ACA-type mandated coverages, but let people choose a variety of coverages within some limits so that we can have more affordable coverage for individuals and families. That's what we're trying to do.
A lot of folks have focused in on the impact of Medicaid cuts or the rollbacks of expansion when it comes to substance abuse and mental health. Given the scope of the opioid epidemic, both in your district and nationally, feels a little bit like opening the sunroof while it's raining, the worst possible time to take that action. Your thoughts?
Opioid abuse is a crisis of monumental proportions all around our country, and there is going to be additional funding both through the health plans, but also through other sources that were enacted just last year in Congress. I think there's a broad bipartisan consensus on that. But again, the key on Medicaid, when you use the word cut, well, most people don't realize that every single year the states would get more money from the federal government under the Medicaid plan that is being advanced in the House, for instance. It is not as much as was promised under the ACA, and that gets back to my earlier point that there's not a bottomless well of money.
The concerns that I've heard from most people when talking about health care, especially in light of the proposals in both the House and the Senate, focus on essential benefits that were provided under Obamacare, pre-existing conditions, which was guaranteed coverage under Obamacare, and then the elimination of both lifetime and annual limits on coverage. How do you respond to voters' concerns about those items?
Well, there aren't any lifetime caps in the House bill. Pre-existing conditions are protected under the House legislation, and the limited waivers that are granted under the House bill, for instance, are so minute. Frankly, they don't even cover or affect anyone in New York State because of state law. So I think that there's a gross misrepresentation of some of the efforts that are being made here. What I would like to see, Andrew, I'd like to see more flexible plans. Right now, the ACA said you have to buy an ACA-approved plan with all the bells and whistles. And you know, a lot of people have coverage in a bronze plan, for instance, but their deductibles are so high that the insurance isn't any good. So if you really have a catastrophic, life-changing event that could bankrupt you or your family, we should provide that kind of insurance so people can buy that kind of coverage.
Let me just push back on the life-altering event that you just mentioned a little bit before. You said people who need coverage for those kinds of things can certainly buy it if they want to, and you want to give people a choice. But how is anybody supposed to know they're going to have one of those life-altering events beforehand so they can buy the right insurance to cover them in case they have one?
Andrew, here it gets to, we have a variety of choices in the marketplace for all sorts of products and consumer products. You have a choice of what hospital you go to, what physician you go to, etc. You should also have a choice to buy a high deductible plan or a catastrophic plan if you want that kind of coverage. Combine that with a health savings account to pay for routine expenses. The ACA doesn't let you do that. So people should be able to buy a catastrophic plan which would cover them if they have costs above $10,000 or $15,000, or if they have a very, very serious life-threatening illness which is going to cost a lot of money. People should have the option in America to buy a plan like that. The ACA says, no, you can't. You have to only buy what Washington bureaucrats, what Congress says you should buy, and that's the wrong way to go.
Up next, more with Congressman Faso, including his feud with Governor Cuomo over the controversial amendment Faso got into the health care bill. The governor lashed out. Now the congressman is fighting back.